Good day to all, both within the military community and our esteemed civilian population. I am Brigadier General Boitumelo Joyce Dube, Director HIV Programs within the South African National Defence Force. As we gather to commemorate World AIDS Day, I am reminded of a poignant statement made by the Surgeon General of the South African National Defence Force, Lieutenant General N.P. Mappa, during the conferment of my rank. He said, I quote, "General Dube, we have forgotten, but the people are dying as a result of HIV and AIDS." Open quote. This statement resonates deeply as we reflect on our collective journey in the fight against this epidemic. Globally, we have seen significant advancement in treatment and prevention strategies, with millions of lives saved through antiretroviral therapy. The introduction of antiretroviral therapy has transformed HIV from a death sentence into a manageable chronic condition. In South Africa, we have seen remarkable progress, with over 5.6 million individuals receiving antiretroviral therapy as of 2021. This is a testament to our dedication and the tireless efforts of healthcare workers, policymakers, and community leaders. However, we must not become complacent. COVID-19 pandemic has disrupted health services, diverting attention and resources away from critical HIV programs. Many individuals living with HIV have experienced interruption in their treatment and care, which can have a devastating consequences. We cannot afford to forget this vulnerable population. We must ensure that HIV services are integrated into the broader health systems, making them resilient against future challenges. This year, we honor World AIDS Day under the theme Equal Rights, Equal Care, a powerful call to protect public health by protecting human rights. This theme reminds us that access to care and treatment should be a fundamental right for everyone, regardless of their age, gender, or background. We must ensure that no one is left behind in our quest to eradicate the stigma and barriers that prevent individuals from accessing the care they need. HIV/AIDS continue to disproportionately affect women and girls globally. In many regions, women account for a significant percentage of new infection. Factors such as gender-based violence, economic inequality, and limited access to education and healthcare contribute to this disparity. In South Africa, the statistics are alarming. We see that young women aged 15 to 25 account for a substantial proportion of new infection, and this makes them more vulnerable than their male counterparts. The military community is not exempt from these realities. As leaders, we must advocate for gender-sensitive approaches that empowers women and girls, ensuring they have access to education, healthcare, and support services that protect them from the risk of HIV infection. We need to prioritize comprehensive sexual education and awareness program that engages our youth, equipping them with the knowledge and resources necessary to make informed decisions about their health. In our country, South Africa, we face unique challenges in fight against HIV/AIDS. Despite being the home to one of the largest population of people living with HIV, we also have a robust response system in place. The government has made significant strides in expanding access to antiretroviral therapy, yet disparities persist. Access to care remains uneven, particularly in rural areas and among marginalized communities. As we reflect on the past, we must recognize the importance of community involvement. The military and civilian sector is essential in creating a unified front against this epidemic. Together, we can challenge the stigma around HIV and AIDS and advocate for the rights of those affected. As we commemorate World AIDS Day, let us renew our commitment to the fight against HIV/AIDS. Let us stand together, military and civilian, united in our belief that equal rights means care for all. Today, I call upon the military community and the civilian population to join me in renewed commitment to action. The fight against HIV and AIDS requires a collective efforts. Government, healthcare providers, communities, individuals, all working together to create a meaningful change. We must advocate for increased funding for HIV prevention, treatment, and research. We must push for policies that addresses the underlying causes of vulnerability, such as gender inequality and poverty. In conclusion, as we mark World AIDS Day, let us reaffirm our commitment to ending the HIV epidemic. Together, we can create a world where everyone has access to the resources they need to live healthy and fulfilling lives. The time for action is now, and together we can turn the tides against HIV and AIDS. I urge each one of you to reflect on the words of the Surgeon General. We have forgotten, but people are dying as a result of HIV and AIDS. Let this not be our reality. Let us remember those who have lost their life, those who continue to fight, and those who need our support. Let us honor the memories of those we have lost by amplifying the voices of those that are currently affected. We can no longer afford to forget. We must remember, act, and advocate for a future free of HIV and AIDS. Equal rights, equal care. Thank you very much.
South African Military Health Service, towards military health excellence.